finish one off, and I promise, Melina, I know I don't want you to be bored, so we'll get through these as best and quickly as we possibly can. All right, so let's finish this up. So, in the trachea, again, um, we have the C-shaped hyaline cartilage right here. Get rid of this little piece here. Sorry. So, and again, guys, this is the first time I ever made these, so I'm doing the best I can here, and we're going to get to this together, I promise here. So, you have the ciliated mucosa beaten continuously with the opposite direction of incoming air. So, as you bring the air in, you have ciliated mucosa, whatever, is trying to go other way out to try to continuously get stuff out away from you. That's why, again, when you're older and you have a lot of stuff built up inside you, or you're sick, you're constantly trying to cough this stuff up. It's the whole definition of what it is. All right, you're trying to put all this stuff back. Walls are reinforced with these C-shaped hyaline cartilage to try to make it, stay so the passageway opens up. But if you do happen to get food in there, this is where the Heimlich maneuver comes in, because you pulse that thing. It basically does this, the beating continuously in the opposite direction of incoming air. You're just giving a forceful one of this to try to help that stuff expel instead of the mucus that's normally trying to be expelled, trying to get rid of the food and that kind of stuff as well. So that's your windpipe. All right. Now, once you get down below that, we have the primary bronchi. All right, formed by the division of the trachea. So the trachea, the big trunk of the tree, starts to separate down the trachea. All right, it'll enter the lungs at the hilus, which is the medial depression. I can show you right inside the chart or whatever, but I don't have the video on for that. All right, the right bronchus is wider, shorter, and straighter than the left is. Bronchi subdivide into smaller and smaller branches. Those of you who ever get bronchitis, all right, sorry, I'm going to cough, sorry. Ever get bronchitis, all that is an inflammation of this, and that can be caused from allergies, that can be caused from a sinus infection, that can be caused from chronic bronchitis, or if you're an asthma sufferer, it can be just from like years and years of abuse of this kind of stuff. Smoking does that kind of stuff as well. All right, and so it's those bronchial tube lining that get really, really sensitive, and so that's why when you're sick, sometimes you cough for days and days and days after. Not that you're sick anymore, but it's these primary bronchi tubes that are actually inflamed. Anytime you breathe, especially with cold air, all right, it activates those, and your body wants to then kick that stuff back up again as you go through. But the right bronchi one is a little bit wider and shorter than the other one, and we get to smaller and smaller divisions as we go through this. Inside the lungs occupy most of your thoracic cavity inside there. The apex is near the clavicle during the superior part of it. The base rests on the diaphragm, that muscle down at the bottom, so I'm going to help control the breathing. And that's the inferior portion. Just remember, superior is on top, inferior is on the bottom. Each lung is divided into two lobes by fissures. You have fissures in between there, and so the left lung has two lobes divided by fissures. And if you kind of look, there's pictures in your book, and there's some really good pictures in your book on page 442 and 443. I got it right along with me here, and you can sort of see on 442 the fissure lines. You have the horizontal fissure and the oblique fissure coming down here, and you can see the left one is divided into two, and the right one is divided into three of those lobes. Obviously, the lobes, because the right one is a little bit bigger, so it's going to be segmented into three instead of two. So just remember, the right one's bigger, so let's get to three. It's pretty easy to understand as you guys go through this. This picture here would be, obviously, if we took it, cut it looking straight down from front to back. All right, obviously your ribs are going to be in the back, so that's why people get broken ribs, whatever, easily can pierce into the lungs. So you do this, but as you get down in here, so as you're looking in here, all right, talking about the heart being down into this area right here, and the blood vessels and things that go in there. But here are your trachea tubes coming in here. Right primary bronchus coming into here. Here's your left primary bronchus coming into the left lung in this section. They really can't see the segments of these in this area. But then you're going to take it down. Obviously, the arteries and the capillaries have to be surrounding all of this, and all of this will be working with the air that you bring in and then the air that you expel out. Okay, so the space in between here around the outside is the pleural cavity. You have a parietal pleural on the outside. You have a visceral pleural on the inside. That's kind of the outside of the membrane walls. And then you have your sternum coming right in here to protect your heart. All right, body wall coming up here. And then the root of the lungs called the hilus, right, the hilus part right there, that separation of those pieces right there, where it goes from there. So it's a good shot from that kind of stuff. So the pulmonary visceral pleural covers the lung surface. The parietal pleural lines the walls of the thoracic cavity. Pleural fluid fills the area between layers of pleura to allow the gliding between those pieces. Again, you don't want it to dry out. That's why I want it to be moist as you go through here. And then you just divide into the pieces. So you have your primary bronchi coming down from the trachea, going into secondary, and then the tertiary, and into bronchioli, and then the terminal bronchioli, where your alveolar sacs are going to be, which we'll get to in a little bit. That's the very end of those branches. So again, if you just think of a tree, it's really easy. Just flip it. You have your trachea coming straight down, biggest part of the trunk. Now we divide into two main branches of your bronchi, right and left. Then you get in this primary, secondary, tertiary bronchioli, and then terminal bronchioli at the very end. Just a small piece at the very end, so we just call it the terminal one as you guys get in here. So again, looking at these pieces, see how it looks sort of like a tree. Breaking down here, and obviously we've segmented from the main one coming in here, coming these little pieces down here into the bronchioles. And in the bronchioles, you have your alveoli sacs coming here, like little grapes coming in this area. All right. And again, getting down to alveolar duct for the alveolar sacs coming in this area, these little pieces and pockets. And this is where the transmission and switching of the oxygen and carbon dioxide is going to take place. So people with lung cancer or people with emphysema or other kinds of respiratory things, this is the part that they attack. Hello, COVID-19. Okay. We get down into this area, the things are already worn from respiratory ailments that these people already have. And that's the thing it's getting. It's getting people with lung cancer. It's getting the people with chronic bronchitis. Is because these things are already damaged. And so now the gas exchange can't take place. And the gas exchange can't take place. All right. Then we're going to look at it and say, okay, what has to happen to your body? Well, obviously your heart has to work faster. It's not getting air. So this is why people who have shortness of breath are the only ones who should ever go to the hospital for this. All right, I keep saying all these people about, well, there's not enough people getting tested, not enough people doing. It doesn't matter. You don't have to get tested. You don't have to get tested at all. I mean, I know it sounds terrible, but if you're sick, stay home. The only reason you have to go is if you're having breathing problems because you've had so much damage to the alveoli and the alveolar sacs that you can't take the oxygen that you need down in your bronchioles. Okay, so that's just kind of where that piece and parts take place. All right, sorry, not advancing like I wanted to. I don't know why. All right, come on. Okay, sorry. Okay, let me go back here. So in the structure of the alveoli, you have the alveolar duct, the alveolar sac, the alveolus, and then that's going to be the gas exchange area going down to this area. So just this finite piece down in here. So there's the duct, there's the alveolus, the individual one right there. The sac is the combination, like the bunch of grapes of that piece holding all the alveoli, which are the alveolus in plural form. All right, and make all that stuff go for that. All right, so you can look at all how that stuff works as you kind of get into all of these pieces, getting into how all this stuff works. All right, we will start here with the layers and how all this kind of stuff works on Wednesday. Okay, take care of each other, be good. Hopefully you guys are going to be okay. Get the stuff done. So what I'm going to do again is I'm going to assign things to you, a couple problems out of the book for you just to submit on Canvas, and then I can grade them and look at them and make sure we're all on the same page. But then I'll also tell you what pages that I want you to work on in the packet as we get through this. Okay? All right. Have a great day, everybody.